Hi, I'm Dr. Nicole Vane of Moonlight Beach Dental. In another one of the videos, I talked about how second opinions on root canals are one of my most common second opinions that I get. The other thing is, can I save a tooth that possibly can't be saved? So, holistic is amazing. Holistic, you heal faster. We're using your own body to guide your healing, especially with extractions. We're using ozone to accelerate healing. I'm using IV nutrition and supplements to support your health and your gut health. However, if a tooth is dead, it cannot be brought back to life by using ozone or laser. So one of the common sayings in our holistic forums is, if it's metal or dead, get it out of your head. So a lot of people have a lot of dental materials in their mouth that are full of metals, which can interfere if people have metal toxicity. If it's dead, a dead tooth, it may or may not have a huge abscess like this patient does on the screen. It may just be that it's something we noticed on an x-ray. People come in, I read about you, I watched your videos. Can you use ozone? So I have an ozone machine in every single one of my operatories. I have an ozone unit that makes the water fresh all day long and does high potency gas for certain injections I can do. However, if it's dead, ozone will kill the infection that's around the tooth. If you have a draining abscess, it'll literally collapse the fistula, clean out all the bacteria there, but it's a temporary effect. And that's one thing I do want people to understand, is it's temporary. It's going to kill the infection, but then the bacteria, they're still allowed to be harbored inside of the tooth. Then it's going to keep returning and circulating throughout your body. And in another video, I showed how this particular patient, the infection went through his sinus and his body was trying to suppress the infection with laying down all this inflammatory tissue. So where ozone's great is when I take the tooth out and I clean out the infection, I can use the ozone gas to go up into the sinus, clean out all this residual infection that in this patient's case, it's been sitting here for a long time. But what it can't do is be injected next to the tooth and bring the tooth back to life. Ozone's great at increasing circulation, so if an area is becoming gangrenous, you can help save tissue that is starting to die, but you cannot save a tooth that's already dead, because what happens is the ozone can't penetrate inside of the tooth and bring it back to life. So we've all watched the movie Pet Sematary back in the day where, we bury our favorite pet and it's brought back to life. I wish I could do that with ozone, but that's not one of the powers that it has. I'm happy to talk to you about all your options. I use it on almost every procedure here in the office, but I would be wary of any dentist, now that ozone's becoming a more popular term, that says they can do things with it that ozone simply is not capable of. I would also ask the dentist what type of ozone training they've had. Lately, I've seen a lot of dentists who are very misinformed because they've never taken any of the training. They don't have a strong enough ozone unit. They don't even know how to use it. They don't understand the science behind it. So please ask your dentist where they got their training, how they're using the ozone, and ask more questions so that you're not being sold essentially a bag of goods and being charged for something that actually isn't going to be a curative thing for you. That and any other questions you have, I'm happy to answer here at Moonlight Beach Dental.